Hi, I chose to look at health insurance whistleblower Wendell Potter, who is the former vice president of corporate communications for Cigna. And Potter had over 20 years of experience in communications for the healthcare industry. He became increasingly aware of the adverse climate of for profit insurance companies. Um, Such as pricing out certain illnesses, or as he referred to it, he called it dumping the sick. Uh, he saw a lot of disingenuous discussions going on around healthcare reform. This was back in 2007, 7 and 8, right around the time that Obamacare started coming up. And um, the president was being told one thing by the industry, and the industry itself was going about doing something completely different. So his involvement in PR, he was the vice president of communications, um, had him involved in many situations where he was managing crisis communications. He experienced his own crisis of conscience shortly after he attended a free clinic that was held near his hometown. The background of the situation was that he was supposed to write an article or a white paper on why why the uninsured had chosen to be uninsured, that it was a choice and that they had chosen to be uninsured, and that it wasn't as big of a problem as other people were making it. So he was asked to make this white paper. So he was at his hometown and saw a free health clinic going on. That he would go and check it out, as background research for his white paper. And when he was there, he saw hundreds of people lined up. They had come, out of the poorer areas of West Virginia and Virginia, out in the rural areas. And a lot of them were employed, but their employment just didn't offer them benefits. And they were younger because a lot of the older people were, covered by Medicare. So this really got to him. It really struck him. And he ended up, he just started re-examining everything that he had been doing. He resigned from Cigna in 2008. And about a year after he resigned, he started to speak out in support of healthcare reform. He had signed a non-disclosure statement with Cigna, so he doesn't talk, he can't talk about any of the details of Cigna's policies, but he does talk in general terms about the standard practices of the health insurance industry. He actually testified in front of the United States House of Representatives Democratic Steering and Policy Committee in 2009 on this particular issue. And he's involved in a lot of nonprofit events and groups that speak out against or speak out in favor of healthcare reform. So unlike our readings, such as the one from the Wall Street Journal, where it was talking about a $14 million award for somebody that was a whistleblower, Potter didn't take part in the SEC whistleblower program. He didn't receive any money as part of a settlement. He's doing this all on his own. So what he does is shines a light on the unethical practices of larger for-profit health insurers. The Santa Clara University article talks about encouraging whistleblowing in organizations, and it outlines some of the attitudes that whistleblowers can expect to encounter. And the information in that article, and particularly the attitudes that whistleblowers will encounter, is supported by Potter. He actually said in a Time article, which I'll link the source to, he talks about his outspokenness costing him friendships of former colleagues. He says, they're not people I go out and have a beer with these days, that's for sure, but I'm not saying I've lost them as friends forever. What he's done is very controversial, as with any whistleblower's actions. It's very polarizing. So, in terms of justice, Potter recounted a story in another interview that I'll link to, where after visiting the expedition the healthcare expedition, is what they called it, but the health fair at this location, it was actually a fairgrounds. I don't think I mentioned that. But he had to fly somewhere shortly after that on the company's plane and realized the injustice that he and the company were benefiting from denying people coverage that needed it. He was off flying around and eating fancy meals on the company dollar while there were people in need of health care that were not getting it. As far as loyalty, like I said, Potter had spent 20 years in the industry. He was vested with Cigna, he had a pension, and he had built relationships with the people he worked. So there was that internal struggle of being loyal to the life that he had built versus doing the right thing. And the risk was that by speaking out, he was going to be losing the relationships and the friendships that he had with the people that he had worked with. The reward was that he wanted to help healthcare reform and help those that needed it, and also help atone for what he had been a part of for so many years. And the impact, Potter's actions have helped healthcare reform. He's met with politicians privately, spoken before Congress, and even to this day, he continues to bring to light problems within the healthcare industry. From my own perspective, I think this case study and readings have deepened my own feelings towards justice, loyalty, risk, rewards, and impact. The decision to speak out against wrongdoing can be a difficult one, and I think it's imperative to look at these 5 factors and weigh them in relation to your own life. Although I don't work for a health insurer, I do work in the insurance industry, and I firmly believe that some of the misinformation comes from confusion. So I personally would like to use social media outlets to help educate people on the processes and whatnot around property and casualty insurance. Thank you.